Hello, dear readers. We all know personal hygiene is key to staying healthy, especially for seniors, whose immune systems and physical strength tend to weaken over time. Among daily routines, bathing might seem like a simple task, but for older adults, it's an activity that can significantly impact both physical and mental health if not done properly. Many assume bathing is just about keeping clean, but for seniors, it's a health matter that demands careful, science-backed attention. As we age, our bodies become more sensitive to changes in environment, weather, and temperature. Shifts in circulation, breathing, skin condition, and temperature regulation make bathing a potentially risky activity for seniors if factors like timing, water temperature, duration, or even bathroom ventilation aren't considered. Some seniors stick to bathing habits from their younger years, unaware that these seemingly harmless routines can lead to serious issues like low blood pressure, strokes, pneumonia, or bathroom falls. Tragic cases have occurred where seniors suffered strokes from late-night baths or lost consciousness from bathing too long in poorly ventilated spaces. These incidents are a wake-up call for families and communities to rethink this everyday activity. Alongside monitoring diet or exercise, teaching seniors to bathe safely is a vital part of elder care. That's why today's article is dedicated to you, especially those caring for grandparents or parents, offering a clear, practical look at bathing habits seniors should avoid. Our goal is to help you adjust daily routines to ensure your loved ones stay healthy, safe, and comfortable. Let's dive into the specific habits to steer clear of to protect seniors' health effectively. As we enter our golden years, the body undergoes significant physical and physiological changes. These shifts make seniors more vulnerable to their surroundings, especially during seemingly harmless activities like bathing. If not done carefully, improper bathing can lead to serious health consequences, sometimes even life-threatening ones. First, the cardiovascular and circulatory systems weaken with age, reducing the body's ability to regulate temperature. Bathing in water that's too cold or too hot can trigger extreme reactions. For example, cold water in the early morning or late at night can cause blood vessels to constrict suddenly, leading to abnormal blood pressure spikes or drops, dizziness, fainting, or even strokes. Conversely, overly hot water can dilate blood vessels, lowering blood pressure and causing lightheadedness or fainting if not caught in time. Additionally, senior skin becomes thinner, drier, and less elastic, making it prone to irritation and damage. Using harsh soaps, bathing too often, or soaking too long can strip the skin's natural oils, leading to cracking, itching, infections, or chronic skin conditions. Improper bathing doesn't just affect appearance. It can lower quality of life, causing discomfort, sleep issues, and reduced mobility. Weakened bones, joints, and balance also increase the risk of falls in wet environments like bathrooms. Studies worldwide show that most injuries or hip fractures in seniors happen at home, particularly in bathrooms lacking safety features like grab bars, non-slip mats, or shower chairs. Even a minor slip can lead to severe outcomes like broken hips or head injuries, drastically reducing independence. Bathing when hungry, right after a big meal, or after intense physical activity also carries risks. Bathing on an empty stomach can cause blood sugar to plummet, leading to dizziness or fainting. Bathing right after eating when the digestive system is working hard can divert blood flow unevenly, causing bloating, stomach pain, or digestive issues. Similarly, bathing after exercise or outdoor work, when the body is sweaty and overheated, can lead to colds or heat shock. Finally, an often overlooked but critical factor is bathroom ventilation. Many bathrooms are designed with little to no airflow, especially in apartments, causing humidity and steam to build up. This can reduce oxygen levels, leading to dizziness, breathing difficulties, or fainting during long baths. For seniors living alone, these situations are especially dangerous, as help may not arrive in time. In short, improper bathing can seriously affect seniors' cardiovascular health, nervous system, skin, and physical safety. It's not just about hygiene, it's about comprehensive health care. Understanding and avoiding bathing risks is a crucial step toward helping seniors maintain a healthy, independent, and fulfilling life. One of the most common yet dangerous bathing habits among seniors is using water that's too cold or too hot. Many stick to cold showers from their youth to stay tough or opt for scalding hot water to relax and warm up. But with age, the body's reduced adaptability makes both extremes harmful. Cold water causes blood vessels to constrict abruptly, spiking or dropping blood pressure. While younger bodies can adjust, seniors, especially those with heart disease or blood pressure issues, risk dizziness, fainting, or strokes. Medical studies show cold water exposure without acclimation can disrupt heart rhythms, cause temporary breathing issues, or even lead to death if untreated. Hot water, on the other hand, dilates blood vessels, diverting blood to the skin and away from the brain. This can cause dizziness, rapid heartbeats, or falls, particularly dangerous given the risk of fractures or head injuries. Hot water also strips seniors' thin, dry skin of natural oils, increasing the likelihood of irritation, burns, or chronic dryness that seniors may not immediately notice due to reduced skin sensitivity. To stay safe, seniors should use lukewarm water around 97 to 100 degrees Fahrenheit, avoiding extremes that feel scalding or chilly. Test the water with the back of your hand, a sensitive area similar to facial skin, for accuracy. This simple step can prevent unnecessary health risks. Another seemingly harmless habit is bathing for too long. Some seniors linger in the bathroom for relaxation or to feel extra clean. But staying in a wet, humid environment, especially with warm water, can lead to serious cardiovascular, respiratory, and safety issues. Seniors' bodies struggle to regulate temperature, so prolonged water exposure, hot or warm, causes gradual heat loss. This constricts peripheral blood vessels, lowers blood pressure, and can leave seniors feeling dizzy, nauseous, or chilled after bathing. In poorly ventilated bathrooms, low oxygen levels heighten the risk of mild oxygen deprivation, which can cause fainting without warning, especially dangerous if no one is nearby. Long baths also dry out seniors' already fragile skin, leading to flaking, cracking, or irritation. Those with conditions like eczema or psoriasis are especially vulnerable. For seniors with joint or mobility issues, prolonged standing during baths can cause muscle fatigue, pain, or loss of balance, increasing fall risks. A common issue for those living alone. Ideally, seniors should limit baths to 10 to 15 minutes. Shorter baths are just as effective if done properly. Family members should encourage quick, safe bathing and ensure someone is nearby if needed, a key step in preventing hidden dangers. Another risky habit is late-night bathing, especially after 9 p.m. Many believe a late shower helps them feel clean and relaxed before bed. But for seniors, this can be dangerous, particularly in cold weather or winter. At night, environmental temperatures drop, and seniors' bodies struggle to maintain warmth, risking hypothermia when exposed to water, especially cold water. Weakened cardiovascular and respiratory systems make sudden cold exposure dangerous, potentially causing blood vessel constriction, blood pressure spikes, heart rhythm issues, or strokes. Hospital admissions for strokes triggered by late-night baths are not uncommon. Nighttime is also when seniors are more fatigued and less alert, increasing the likelihood of slips or falls in the bathroom. To stay safe, seniors should bathe before 7 p.m., when their bodies are warmer and more alert. If a late bath is unavoidable, wiping down with a warm cloth is safer than a full shower, and the bathroom should be draft-free with someone nearby for support. Bathing when hungry or right after a big meal is another habit to avoid. These are times when the body, especially in seniors with less efficient digestion, circulation, and nervous systems, isn't ready for bathing, and poor timing can lead to serious health issues. When hungry, blood sugar levels are low, particularly for seniors with diabetes or low blood pressure. Bathing, especially with hot water or after a tiring day, can cause blood sugar to drop suddenly, leading to dizziness, cold sweats, or fainting. For seniors living alone, this can be life-threatening if help isn't nearby. Bathing right after eating also poses problems. After a meal, blood flow prioritizes the digestive system. Bathing, especially with cold water or long soaks, diverts blood to the skin, reducing digestive efficiency and causing bloating, stomach pain, or chronic digestive issues. To stay safe, seniors should avoid bathing when overly hungry or full. The best time is 30 to 60 minutes after a meal, when digestion has stabilized. Quick baths with lukewarm water help maintain stable body temperature and protect overall health. Bathing right after intense physical activity is common but risky for seniors. After exercise or heavy work, many feel sweaty and want to shower immediately to feel clean and refreshed. But for older adults, this can harm health if not done carefully. During intense activity, body temperature rises, sweat cools the body, and heart rate and circulation speed up. Bathing immediately, especially with cold water, can shock the system, causing peripheral blood vessels to constrict, blood pressure to spike or drop, and dizziness or headaches. For those with heart conditions, this can trigger strokes. Even warm water can be tough on a fatigued body, increasing the risk of colds, exhaustion, or muscle cramps, especially in seniors with joint issues. Seniors should rest for 20 to 30 minutes after activity to let the body recover and stabilize temperature. Drinking water with electrolytes before bathing adds an extra layer of safety. Bathroom ventilation is a critical but often overlooked factor in senior safety. Many bathrooms, especially in apartments, are sealed with no windows or effective exhaust systems, trapping humidity and steam. This creates a risky environment for seniors. Hot showers produce steam, making the air stuffy and reducing oxygen levels. Seniors with weaker respiratory and cardiovascular systems may feel short of breath, dizzy, or faint during long baths in such spaces. Fainting in a bathroom, especially for those living alone, can lead to severe injuries or worse if help doesn't arrive quickly. High humidity also makes floors slippery, increasing fall risks for seniors with poor balance. To mitigate these dangers, bathrooms should have windows or exhaust fans to ensure constant airflow. Leaving the door slightly open during baths is a simple, effective way to keep the space safe and comfortable. Another subtle but harmful habit is using harsh soaps or bathing multiple times a day. Some seniors feeling sticky or itchy shower frequently and use strong, foamy soaps to feel cleaner. But this is harmful to aging skin and health. Aging skin is thin, dry, and less elastic. Frequent bathing, especially with harsh soaps, strips natural oils, causing dryness, flaking, or chronic itching. For those with eczema, psoriasis, or allergies, this can worsen symptoms and lead to infections, lowering quality of life. Multiple daily baths also disrupt body temperature and immunity, especially with hot water or poor timing, making seniors prone to colds, fatigue, or insomnia. Seniors should bathe once daily or every other day in cold weather, using gentle, fragrance-free soaps with moisturizing ingredients to keep skin healthy. Thank you for sticking with us to the end of this article/video. As we've seen, bathing may seem like a routine task, but for seniors it requires careful, science-based attention. Habits like using overly hot or cold water, bathing too long, showering when hungry or full, or bathing in stuffy bathrooms carry serious risks, from blood pressure issues and breathing problems to falls or strokes. For seniors, these mistakes can lead to lasting consequences or even be irreversible. Adjusting bathing habits for seniors isn't just about physical care. It's a meaningful way to improve their quality of life and mental well-being. Whether you're a family member, caregiver, or a senior yourself, understanding these risks is key to creating a safe, nurturing environment. Beyond timing, water temperature, bath duration, and skin-friendly products, consider upgrading bathrooms with grab bars, non-slip mats, and good ventilation to minimize risks. Small actions like opening a window or reminding loved ones not to bathe late can be powerful safeguards. If you found this helpful, please like, share with family, and subscribe for more tips on senior and family healthcare. Here's to you and your loved ones staying healthy and happy every day.